Cardiologists across the world and right here in our area are saying that fewer patients presenting heart attack symptoms at ERs, but not because less heart attacks are happening.
News Channel 9's Aaron Cooper talked with local doctors, advocates, and survivors of heart disease who explain how the virus is discouraging folks from getting that life-saving help they certainly need.
And it hit me like a snap of a finger.
Right before the pandemic hit, Jim Appleberry was trimming trees in Lookout Valley with his dad when he felt chest pains.
When I sat down, I started sweating. So when I started sweating, I told him he needed to call ambulance 911.
With no prior warning signs, Jim was having a heart attack. He was rushed to the hospital.
After it was all over with, they told me I had coded. He believed that if I'd waited 5 more minutes, or if it had been 5 more minutes, I wouldn't be here today talking to you.
I tell all my patients, don't diet out.
Dr. Mandawat is a cardiologist at CHI Memorial. He's noticed a worldwide trend of less patients coming to the ER with heart attack symptoms since the pandemic began. At CHI Memorial, he says there's been a 25% drop in ER heart attack patients. He says not because there's less heart attacks happening, rather that people are afraid of getting COVID-19 at the hospital.
However, the ones that are coming in much more sick. And as a result, are having, I think, poorer outcomes than pre-COVID.
Mandawat thinks people are waiting 2 to 3 days with these symptoms before they get medical help. He says that makes it harder to recover if you can.
The risk of acquiring COVID from a healthcare facility is very low. The risk, however, of having bad outcomes from untreated heart disease is actually really high.
My biggest fear is that people are dying at home.
Emily Nespajani is the executive director for the American Heart Association in Chattanooga. The organization launched Don't Die of Doubt in June, a campaign with resources to reassure that healthcare staff and emergency rooms are prepared to keep you safe, even in a pandemic.
To get to the emergency room, call 911. Don't wait, because heart disease and stroke aren't staying at home just because of the pandemic.
This cardiologist, this advocate, and this survivor urging you to get to a hospital immediately if you have chest pains, shortness of breath, nausea, excessive sweating, or jaw pain.
I go to the hospital 3 times a week, and I have not come down with COVID. So I'd say go, do not wait.
Reporting in Chattanooga, I'm Aaron Cooper.
You can check out those resources from the American Heart Association on our website as well, newschannel9.com.